David, well, it's Wednesday, and that means it's time for Healthy Living. Today, Tina Elliott joins us from the Indiana Rural Health Association to talk more about what they have to offer. So first off, tell us a little bit about the association.
Well, the association educates, advocates, and networks. We actually oversee all of the 35 critical access hospitals in the state of Indiana and the 62 rural health clinics.
And you manage several grants.
And we manage several grants, one being the laying of the fiber optics throughout the state of Indiana for health information technology. Another one, emergency preparedness, to make sure that all of our clinics and hospitals are prepared for any type of emergency. And we also offer a lot of workshops and conferences, and we are the largest state rural health association in the United States, and every state has a state rural health association.
And you really get out there and promote good health. You brought some visuals with you today. Community fairs are big just to get the word out. And tell us about some of these props, because I think people at home like to see the visuals as well.
The visuals are great. When we go to community health fairs, people like to see the 5-pound slab of muscle compared to the 5-pound slab of fat.
And it's much different.
Definitely, you can feel the difference, and you want to be nice and solid like that muscle. We have a portion plate here, which shows that a half of our plate should be at least fruits and vegetables, and we have a bingo game that the children can actually play, and this is the food pyramid bingo. We also have different blocks that hold test tubes, like the one Susie is pointing to now.
This one right here.
That one holds the sugar that's in 12 ounces of pop.
Really?
That's pretty amazing. When children and adults both see that test tube full of sugar, they just vow to give up pop altogether. So we have various amounts of sugar, salt, and fat in the contents of the food that we eat.
How about salt? How about this one? Because I know a lot of it's been in the news a lot lately about the salt intake we have.
The salt is the front block.
The front.
And,
this one.
That one. And there's really salt in everything that we eat. Even Grandma's homemade soup with no salt has just a little tiny bit of salt in it. And we have a daily average that we're supposed to consume, but we're not supposed to go over that average. And then, of course, I was talking with your gentleman here in the studio about the 3 test tubes of fat are in 1/4 pound hamburger, and so we were all talking about the fat contents in the foods that we eat. We also disseminate a lot of information to the people at the fairs and the conferences that we go to about asthma and diabetes, and as you can see, we have information in Spanish and in English, and the effects of smoking. And one of our grants that we do have is to promote the smoke-free ordinance for the state of Indiana.
So you are definitely very, very busy.
We are very busy and very visible, and we are trying to get our word out that Indiana Rural Health Association does a lot for the rural areas all over the state.
Now, if anybody has any questions about the Rural Health Association, where do you encourage them to go?
They could go to our website at www.indianaruralhealth.org, and it will have all of the information where someone could contact any staff member.
And all that information is up there on the screen for you. Thank you so much, Tina.
Thank you.
Lots of information, and I definitely like the visuals, and I'm not a fan of the fat. Well, Tina, thanks again, and Healthy Living airs right here on Wednesdays. For more information on Healthy Living, all you have to do is go to our website at WTHI-TV.com. News 10 at midday. We'll be right back, so stay with us.